I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Fun show today with answering a question. And the question is, do anti-aging supplements really work? And the answer is yes, if they're good ones. My German grandfather, I quote him so many times, he taught me something years ago. He said, always buy the best. It's always cheaper. He was a master carpenter, and he didn't have a lot of tools, but the tools he had were so well kept, always sharpened, clean. And so always buy the best. It's always cheaper. Same thing goes for supplements and food and healthcare, because if you're spending too much money on something that doesn't work, it could just be a scam. So we're going to go over what works, what doesn't work, how to spot a good one. We're going to talk about what's a good omega-3, what's a good vitamin D. Those are two that really do work for anti-aging, by the way. And we're going to discuss where to get them as well, what to look for. So you become the smart consumer. You make better choices, because that's what we're shooting for, is you understanding how to get yourself well. So we're still looking for that mythical fountain of youth. There is no fountain of youth. You're not going to take something, oh my gosh, I'm 16 years old again. But there are ways we can fight the aging process, because we know what the aging process is. We've really done a lot of research on it. And once we understand how it works, then we can fix it. I tell every patient that comes in my offices, we're going to try to get to the cause of your problem, not just treat the symptoms. You can put makeup on to cover up a wrinkle, but let's find out where the wrinkles are coming from. Now, we're all going to age. This is the end all be all. We're all going to age. But if we do it gracefully, we're also going to do it, we're going to be healthier if we do it the right way. And so that's hopefully going to add some good quality years to your life. So you think about pills and potions and rubs and scrubs and, anti-aging supplements, and they're all over the market. Most of that you're hearing about is probably just smoke and mirrors. It's not really going to work. So if you want to look younger, I want to talk about what supplements are going to work, how to feel younger as well, how to have more energy, because that's one of the big problems I see in my practice is patients come in and they say, well, Dr. Joe, I'm tired all the time. I'm just worn out. You're getting older. You're not going to do the things you did when you were 16. It just is what it is. But let's talk about what supplements are and what you can expect, hopefully, from good ones, and then some of the best anti-aging supplements. And then we're going to find out, if we have time today, why too much iron could be the reason why people are sick and dying. One of the reasons, especially heart attacks. You always think about not enough iron. Too much iron is actually a worse problem. We're going to cover that today too. So you think about supplements, minerals, face creams. You want to smooth out the lines and wrinkles. The benefits of anti-aging supplements are so much more than just skin deep. We want to go really deep into the body. So if you're doing the right diet with chiropractic care, with supplements, these are some of the things, hopefully, you can see. Reduced joint pain, reduced muscle loss, improved vision, increased skin elasticity, stronger bones, enhanced heart health, smoother skin, optimized exercise performance, improved immune system, and increasing your energy levels. So again, you think about anti-aging just looking good. It's actually, I want to talk about it from the inside out, not just from the outside in. So let's talk about supplements right off the bat. Let's talk about exactly what I would suggest you do. Number one, enzymes. We did a show on enzymes a couple of weeks ago, and it was extremely popular because we think about supplements, you think about vitamin E, vitamin D, vitamin C. Those are supplements, but what about enzymes? What are enzymes? Enzymes break things down and then reassemble them. So if I'm going to eat a tofu sandwich, because I'm vegan, of course, I'm going to have a tofu sandwich. Well, it's going to go in my mouth, and salivary amylase, which breaks down sugar, is going to start breaking down the sugars, goes into my stomach, and the main enzyme in your stomach is enzymes that break down proteins. Now, there are other enzymes there as well, but mainly your stomach takes proteins and breaks them into something called amino acids. Now, the amino acids then go into your small intestine, get absorbed, and they're used to build skin and joints and muscles and bones. Everything is made of amino acids. It's proteins. And so we have to have good digestion in order to break the proteins down so you can get the amino acids out of it. As we get older, our digestive enzymes drop. It's part of the aging process. I always say that is the aging process. So something simple I want you to do, have something raw at every meal. Now I say raw, broccoli, cucumbers, tomatoes, avocados, salad. Raw food is going to give you enzymes and help digest not only the food you just ate, but other foods. I also suggest taking a digestive enzyme supplement every time you have a cooked meal. Now, if I'm eating a big salad, raw salad, do I take enzymes? Usually not. But if I'm going to eat anything cooked, whether it's stir-fried veggies or it's tofu or it's a quinoa, whatever it is, if it's cooked, I'm going to pop a Dr. Joe's digestive enzyme. And that helps tremendously. Now, there's different ways you can use enzymes. You can take enzymes with food. Helps digest your food. Awesome. If you take it on an empty stomach, those enzymes get absorbed into the blood because they're not being used to break down food, and they can help fight inflammation. And every disease known to man has an inflammatory component. So we can easily fight inflammation by taking enzyme supplements on an empty stomach. There's also some research out there that shows it can help if you're sick. Because viruses, germs, bacteria, how do you kill them? Enzymes have to get into them and break them down. And so if you take them while you're not feeling well on an empty stomach, there's a little bit of research out there that might help as well. Now, it's not going to hurt you. That's the beauty of it. I mean, if you took a bottle of anything, it's going to hurt you. But I take one Dr. Joe's digestive enzyme every time I eat a cooked meal. And I think you're going to do really well if you do that. It can help with acid reflux. It'll help with gas. A lot of people get gas when they eat. The foods aren't being broken down properly. And so the enzymes we have help break down protein, carbohydrates, and fats. So we're going to absorb not just your protein, but your carbohydrate and your fats better as well, too. So a lot of people with digestive issues, I give them the digestive enzymes, and they just think it's the coolest thing in the world. If you've ever had your gallbladder removed, how many people have had their gallbladder removed? Raise your hands. A lot of you have. I know you have. I'm in practice. I see a ton of patients every day. I've with 4 clinics, 6 doctors. We see a ton of patients, and I'm fascinated how many people just kind of toss it off like, oh, yeah, I had my gallbladder removed, like it's no big deal. Your gallbladder is really important because your gallbladder produces bile, which helps digest fats. So if you've had your gallbladder removed, I recommend you take a supplement, a bile supplement. We use a company called Standard Process, and their name brand is Cholacol. So Cholacol is a digestive enzyme that I recommend if you have your gallbladder removed, you should be taking it every time you eat a meal, unless it's raw meals. And most people, when they take it, are like, oh my gosh, I feel so much better. Because a lot of people have had their gallbladders removed, and it really was a stomach issue. Because I have tons of people have come to me and said, I had my gallbladder removed, I had acid reflux and heartburn and burping and gas and bloating, and I had my gallbladder removed, but it didn't fix the problem. Then we find out it wasn't the gallbladder, it was the stomach pushing up into the diaphragm. And so the stomach was up against the diaphragm and it couldn't digest food properly. My team of doctors are able to go in there and massage or pull the stomach down away from the diaphragm, and then voila, suddenly their problems go away. So it really is kind of cool. We like to check the basic stuff first, and that's what I do to all outpatients. We start basic. Is it a chiropractic case? Is it a nutrition case? Is it a supplement case? Is it a digestive case? Most people are. And when we fix that, it's the most effective, least expensive treatment for back pain. Then if we have to, we have a medical division in our offices. We can go into things like spinal injections, PRP, which is amazing. PRP is great. We take the cells out of your body, the healing cells out of the platelets, concentrate them and inject them back into your body, which helps with inflammation and regeneration. It's not the end-all be-all. It's not going to cure every disease, but it's a natural way for your body to start to heal. It's called regenerative medicine. There are things like stem cells out there, but with stem cells, I'd rather use the PRP. It's your own blood, it's your own body, and it's a lot cheaper. Now, if we have to use stem cells, we always could, but I don't like to make promises with stem cells. I've had too many people lied to with stem cells, and the prices are insane. PRP is way less expensive, and I find in many cases as good or better than the stem cells. And so we could go to the medical route if we need to, but that's a little more aggressive, a little more expensive. Let's try to keep it simple. And that's what we do with our patients. And that's why if you have had your gallbladder removed, I do recommend that you go ahead and start taking Cholacol. Most people are really happy with those results. So first supplement we're talking about today, enzymes. And you supplement. It's not instead of a good diet. It's in addition to a good diet. It supplements a good diet. So enzymes are really important, and I couldn't imagine not having them, especially as you get older. Because as you get older, when you start digesting your food again, you start to have more energy, you start to flatten out your stomach. It really helps too. Now, vitamin C. I get this question once or twice a week on the website. The website, by the way, is drjoe.com, drjoe.com. And people say, what's a good vitamin C? Well, somebody said, well, you talked about vitamin C, ascorbic acid only being 1/8 of the vitamin C complex. I said, no. Ascorbic acid is 1/8 of the vitamin C molecule. It still can be called vitamin C. And some studies say it's exactly the same. Some studies say it's not the same. I believe that it's not the same. Because ascorbic acid is oftentimes made from genetically modified corn, which I'm not a fan of genetically modified foods. And again, it's only a fraction of the whole supplement. So I'd rather you take a whole vitamin C. And you can get vitamin C, of course. You talk about oranges, but a lot of food has vitamin C in it. And it's really one of the top anti-aging supplements available. But if you're eating a good diet, you don't really have to supplement a whole lot. Vitamin C is necessary for the production of collagen, and that's a protein that's involved in the health of your joints, your skin, and your muscles. So as collagen breaks down, that causes wrinkles. It really speeds up that aging process look. One study published in the American Journal of Clinical Nutrition reported that consuming higher amounts of vitamin C was associated with decreased risk of wrinkles, as well as improvement in the appearance of skin. Vitamin C is also great for the immune system, and as we get older, our immune system gets weaker. And of course, immunity is a big topic right now with COVID and flu season and everybody getting concerned, and I'm concerned too. So I want to make sure that you're getting enough vitamin C, not ascorbic acid, vitamin C. Dr. Joe's Essential Source, one of the ingredients is more than enough vitamin C for your whole day. Now, you can do extra vitamin C if you want to, and basically you just pee it out. It's water soluble, you pee it out, no big deal. If you take too much vitamin C, let's assume that you're going to say, well, Dr. Joe, if 1,000 milligrams is good, I'm going to take, 2,000 milligrams. Eventually, you start to get loose stools. You get diarrhea or loose stools. That's a sign you've taken too much because your body has something called a bowel tolerance. What a bowel tolerance is you can only absorb so much of anything in your bowels. Your bowels can only tolerate so much. So if you take too much vitamin C, eventually you start getting loose stools. You know you took too much, cut back. You don't need any more. You don't want to get loose stools either. So vitamin C, really important. Get it from fruits and vegetables. That's really the best source. Dr. Joe's Essential Source, which everybody should be taking anyway. It's the minimum supplement you should take every day. Super Green's an essential source. You're going to get all the vitamin C you need. Now, you've heard me talk a lot about omega-3 fatty acids. Omega-3 fatty acids are what we call an essential fatty acid. What does essential mean? You can't make it yourself. So if something is called essential, you have to get it from an outside source. First thing you think of is what? Fish oil. Fish oil, not my favorite form of omega-3. It's high in the forms of, there's different forms of omega-3, and the form of omega-3 that we utilize is something called DHA and EPA. Those are the two forms of omega-3s that we utilize. Fish, good source of it. However, fish many times is contaminated with mercury and lead and toxic chemicals. And also, if the fish oil is cheap, a lot of times they'll make it, it'll sit on the shelf for too long, and it'll go rancid. And the only thing worse than not having enough good fat in your body is having rancid fat in your body. So krill oil is a better choice than fish oil because the krill oil is in a form called the phospholipid form. And the phospholipid form is the form that the body utilizes the best. So krill oil isn't better than fish oil and much less risk of toxicity. And krill is much more sustainable, by the way, too. There's a lot more krill in the world than there are fish. And so krill oil from an environmental standpoint is even better, but it's less toxicity. But here's the catch. Krill don't produce omega-3 fatty acids, neither do fish. Krill and fish get their omega-3 fatty acids from algae. Algae is the purest form of omega-3 fatty acids. The one I take every day is Dr. Joe's vegan omega-3, which is an algae oil. It's in little capsules. I take 2 a day. That's about 1,000 milligrams a day. That's the minimum that you want to take. I'm going to talk about it if I have time later, that when it comes to Alzheimer's and Parkinson's disease, we found that if we gave people twice that amount, along with vitamin B, we started to see some good improvements on many cases of dementia and Parkinson's and Alzheimer's. So bigger doses are okay, but at least 1,000 milligrams a day. Now, the recommended dose is like 200 or 300 a day. That's not enough. You need 1,000 at least a day. But omega-3 fatty acids from algae is going to be the purest form. A lot of benefits with heart health. So there's a variety of anti-aging benefits with algae oil. And that's what we're talking about today is anti-aging supplements. Do they really work? And the answer is yes. So algae oil, purest form, it's one I recommend. Vitamin C, whole vitamin C, not ascorbic acid. It's in the essential source. You can get it from fruits and vegetables. Water, of course, we're going to talk about that as a supplement. Enzymes, really important as we get older. We just don't break down food like we used to. And that's part of the normal aging process. That's okay to age. But I want to fight it. I want to stay young as long as I can. Because now, finally, as we get older, we figured a lot of life out, haven't we? We get rid of bad people in our lives. We get rid of stupid things in our lives. We don't tolerate junk like we used to. And now suddenly we're too old to enjoy it. I want to enjoy those mistakes that we all made in our lives so that we can really get the biggest bang for our buck as we get older and really enjoy it. Because you think about it, you work all your life, you retire at whatever it is, 65, and the average life expectancy is 76, whatever it is, 72. You only have about 10 years, 11 years to enjoy yourself. I want to make that about 40 or 50 years to enjoy myself. And so we do that by taking care of ourselves. Another supplement that I recommend is vitamin E. Now, you can get this from nuts and good diet, so you don't have to worry about taking a supplement for it, but you can supplement with it. It helps fight something called free radicals. Now, free radicals are like Pac-Man. They eat through things. Waka, 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 waka. So they're eating through things. And vitamin E helps. It's one of those antioxidants. Like glutathione is the master antioxidant. That's the biggest one of all. But vitamin E is another antioxidant that helps fight the free radicals. It can be beneficial to help eye health and prevent vision loss. Of course, that's a big issue as we get older. Now, one study combining vitamin E with an assortment of other essential nutrients was effective in reducing the progression of age-related macular degeneration. Here's the thing with macular degeneration. I have it. I was diagnosed several years ago. I was told by my doctor there's nothing you can do about it. Chances are it's going to progress and you probably go blind from it. And it's done. Genetics. I don't accept that diagnosis. So I got down and dirty, and that's when I started creating things like Dr. Joe's Super Greens, Dr. Joe's Essential Source, digestive enzymes. I really put together digestive protocols and supplement protocols for myself. And if you go to our website, drjoe.com, and type in macular degeneration, you will see that the pictures of my eyes year to year is getting better and better and better. My eye doctor, Dr. Z, she's wonderful. She says every time I go in, she's like, you are an enigma. No one gets better from macular degeneration. It's impossible. You can't get better from macular degeneration, but you are. She goes, and here's the pictures to prove it. So Super Greens and Essential Source was part of my protocol along with a good diet, and my macular degeneration is reversing, which is kind of cool. Vitamin A, another anti-aging supplement you want to consider. And again, you can get vitamin A from a good diet. Now, I don't recommend taking vitamin A supplements because vitamin A in big doses can be toxic. I recommend beta-carotene. Beta-carotene is the form of vitamin A you're going to find in things that are orange. Pumpkin, sweet potatoes, oranges. So vitamin A, orange and yellow foods have vitamin A in it in the form of beta-carotene. Beta-carotene converts into vitamin A. If I take pure vitamin A supplements, I can have a toxic level. If I take beta-carotene supplements, I won't have a toxic level. So I'm okay with that. So I recommend the beta-carotene, and you get that from your foods. So vitamin A is really important for hair and skin, and it helps the sebaceous glands in your skin. Sebaceous is where we produce oil. And it helps with hair and scalp moisturizing. When applied topically, it can, in the form of retinoids, it's called, it can decrease fine lines and wrinkles. It can boost collagen production. Also, getting enough vitamin A in your daily routine can prevent against age-related conditions such as cataracts and, again, macular degeneration. So where do we get all the supplements we talked about from? From your food. Now, I take supplements as well, but none of the things we just talked about are found in animal products. All the things we just talked about are found in plants. Now, if you eat raw meat, there would be some enzymes in there, of course. But the supplements we're talking about are mostly sourced from plants. Now, where do the animals, let's assume iron, which I'm not a big fan of taking iron, by the way, unless you need it. Where do animals get their iron from? Plants. Where do they get the calcium from? Plants. Where do they get all their nutrients from? Plants. So the nutrients that you need are not found in animal products. Well, they could be found in animal products, but they're found in plants. That's the source of it all. Now, the omega-3s, the animals do make the omega-3s, some of them. But again, I'd rather get from the algae, which is the purest form of omega-3s, and that's going to be the healthiest way to go about it. So glutathione is another supplement that I take every single day. Glutathione is the master antioxidant. So this is how it works. I'll give you a little chemistry lesson. You have a toxic chemical in your body, like an acid, let's say. The acid is very reactive. I'm going to take you back to chemistry class. So your body, the acid wants to be neutralized. It wants to be calmed down. It wants to be put in its place. So you have to have something to give it an electron to neutralize this toxic reaction. Glutathione is an excellent electron donor. It has lots of electrons to give away. So it gives away the electrons and it calms down the hyperreactive chemicals that are causing the toxic damage. Very good for the liver. Again, I take glutathione every single day, and it's really good for the immune system. So we talk about the immune system, which I think I seem to be talking about every show lately. Vitamin C, absolutely. Vitamin D. Most of us are deficient in vitamin D. Somebody sent me a question the other day, and they said, how do you know if you're deficient in vitamin D? The answer is, are you alive, and is it winter? And if the answer is yes, you're probably deficient in vitamin D unless you're taking a supplement. Because the only way we get vitamin D is from supplementation, or we get it from the sun. The sun interacts with the cholesterol in your skin, with the UVB rays interact with cholesterol, and creates vitamin D. In the late fall, winter, and early spring, we don't have enough sun. Even if we're out in the sun all day, it's not powerful enough sun. It's not enough UVB rays to create vitamin D. And that's why I recommend everybody take, from, not toddler, but, preteen on, 5,000 international units of vitamin D a day. Sounds like a lot, doesn't it? 5,000 international units? 5 drops of Dr. Joe's vitamin D. And I always have vitamin K2 in it as well, and you need K2 to make the D3 work properly. So I take vitamin D every day, just 5 drops a day. You should too. Now, if it's a smaller child, you can use less, but everybody needs vitamin D. And every time I read a study on vitamin D, it's coming out that it does more. It helps the immune system, the brain function. It helps build bones. It helps with skin. So many different things vitamin D is doing. And if you're not getting enough sun, you're going to be deficient. Now, some doctors will recommend 50,000 international units of vitamin D at once, but they're giving you vitamin D2. Vitamin D2 has to be converted into vitamin D3. You can also get vitamin D2 from things like mushrooms. But D3 is the form that the body utilizes. I know it's a little chemistry there. But I recommend the glutathione and vitamin D, of course, the vitamin C from the essential source, digestive enzymes. These are the things that I've learned in 40 years I've been studying biochemistry and nutrition that work the best. But again, what form? You don't want to do ascorbic acid. You want to make sure that it's pure vitamin C. You want to make sure that the vitamin A is in the beta-carotene form, not in the vitamin A form. Now, you can take some vitamin A supplements. That's okay. Just don't overdo it. Because I know some people think, well, one vitamin A supplement is good. I'm going to take 2. Well, you might not need that much. That's why I'd rather have the beta-carotene. It's much safer levels of the supplements. Now, we talked about the DHA and the EPA, the omega-3 fatty acids, and the B complex. I kind of brushed on that earlier. Dementia affects so many people. If you've ever been affected by someone with dementia, they called it the long goodbye. Ronald Reagan had it. And it's a long goodbye because the person is not there anymore. They don't recognize you as time goes on. They don't recognize themselves. It's really a scary thing. So with dementia, people come to me all the time and say, Dr. Joe, what can we do? And the studies are now pretty clear that vitamin B, along with omega-3 fatty acids, the one called DHA, is really helping tremendously in many of these cases. If you have any questions, go to our website, drjoe.com, drjoe.com. Type in what you're looking for. Chances are we've done articles, radio shows, videos for it. If you want to watch videos, go into the media section. Just type in Dr. Joe's radio show. We have videos there. We have audios. And if you just type it in general, you get everything coming up at once. If you have any questions that you can't find on your own, send me the question through the website, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. So if you'd like to make an appointment to come see us for neck pain, back pain, shoulder pain, degeneration, arthritis, PRP treatments, digestive issues, make it right online, drjoe.com. You can call us, 844-44-DR-JOE, 844-44-DRJOE. Normally, the first visit with us is $375. We've reduced that price to $149. And then future care from there, if we do accept you as a patient, we accept most insurances, car accidents, sports injuries. If the car you were in was ever damaged, you were damaged. You need to come see us right away. I'm Dr. Joe Esposito, drjoe.com. I'm Dr. Joe Esposito. Thanks for tuning in. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.